I'm Peter Bates. I'm an emergency department nurse practitioner here at Girard Medical Center. I started in healthcare, actually as a nurse's aide in high school, and then I progressed to going to Pittsburgh State University for nursing. Worked at local hospitals for a couple of years while I went to the nurse practitioner program, and I've done strictly emergency department nurse practitioner roles since graduation. The emergency department, basically we obviously see and treat patients of all ages for a variety of medical problems, 24/7, day or night. Kind of serve as a safety backup for the community. We don't have a lot of resources around here, so say if they can't get into a family practice or primary care specialist, we're kind of a backup safety net for patients in the after hours times. Come to the emergency department for anything that you deem emergent that can't wait for a primary care appointment or urgent care appointment. It's hard to say, there's so many variables, but if you deem it necessary, it probably is necessary. I've worked in the emergency department full-time since 2013. I started at a bigger hospital and I worked here just on an as-needed basis until about 2022. And then decided I really liked it here. I like the small town feel. I like knowing the patients that I'm taking care of. And that kind of pulled me into doing this full time. You know, in a large town, large city, you have essentially unlimited healthcare resources. University hospitals, urgent cares, walk-in clinics, primary care providers. We are not so fortunate around here to have all of those available to us. And so I think being essentially kind of on an island, a healthcare island, it's very important to provide that service to give patients some sort of a safety net. I like the variability, the unpredictable nature of the emergency department. You know, nothing is scheduled, nothing is routine. You could go from a minor complaint to a critical illness within 15 minutes. I think it's not common. I think there's a lot of communities that are about our size or smaller that do not have emergency department coverage fully staffed. So I think we're kind of unique in that we have this ability to staff an ER and provide this service to locals. At a bigger community, you may treat a patient, you'll never see him again. I like locally because you can see a patient in the emergency department and then I may see that same person at the grocery store or the gas station. I like being able to see the people I take care of in the community, and I don't know, I like building a connection, a relationship with the patients. You're taking care of people at their most vulnerable time. So they come in here usually at their worst, and it's nice to be able to see them out in public doing much better, and they remember you for being a part in making them feel better. At a bigger city, a bigger hospital, you have so many resources. For every problem, there's a solution, where there's somebody dedicated to that problem. At a small hospital like this, again, resources are limited, so you kind of have to wear multiple hats and solve problems as they arise. Flying by the seat of your pants sometimes, and so knowing that these people are flexible and can make pretty much anything work is comforting. I think we are an excellent emergency department. The care here is very personalized as opposed to a larger healthcare system. So I think that's something that we offer that's unique to us and not bigger systems. So yeah, local, small town, personalized care. I'm Peter Bates and I'm rooted in rural.